I'll be talking to you guys about the mineral calcium. Calcium's role in the body is critical in supporting muscle and skeletal health. Functions of calcium. Calcium is vital in growing a healthy skeletal system, as it is the building block of your bones and teeth. Calcium also helps muscles to contract and allows enzymes to activate. Calcium adds strength and rigidity to the bone structure. Calcium's role in the body. Calcium aids in growing a strong and healthy skeletal system. It helps to prevent bone disease. It's a major component in bone structure. It aids in the muscle contractions. It helps activate certain enzymes. And also takes part in intercellular signaling and hormonal secretion. There are two forms of calcium, serum calcium and then regular calcium, hard calcium. Serum calcium is about 1% of the calcium in the entire body. It's tightly regulated. It does not fluctuate with food intake. It's stored in the soft bone tissue. It's considered a calcium reservoir. And it's somewhere that your blood and your muscles and your cells and all your organs can take from when they are in need of calcium. A calcium bank. Then there's hard calcium, which is 99% of the calcium in the body. It's the building blocks of the bones and teeth. Pretty much your bones and your teeth are this calcium. Calcium helps to create strong structures within the bones and functions to keep them healthy. They add strength and rigidity. Bones are constantly being remodeled. Where the calcium is being removed from the bone, the pre-existing bone is being taken apart to use the calcium, but also having new calcium put back into the bone and rebuilt constantly. It's a back and forth cycle between taking away the calcium and putting the calcium back into the bone, so it's constantly getting fresh, recycled calcium. This also changes throughout your age. When you're younger, children, they will deposit more bone and more calcium than they replace or they remove. As you get older, you start to balance out. As you're middle age, you're a young adult and a middle age, you are making as much calcium, or you're depositing as much. When you're younger, children deposit more bone than they remove. As you get older, you start to reabsorb more bone than you're depositing, but there's a plateau in the middle. As a child, you're developing more bone than you're losing. Then middle age, you're making as much bone as you're losing, and then when you're older, you lose more bone than you're depositing. The RDA for infants is 200 milligrams. The RDA for toddlers is 700 milligrams. The RDA for 4 to 8-year-olds is 1,000 milligrams. 9 to 18-year-olds, 1,300 milligrams. 19 to 51, 1,000 milligrams. 52 plus, 1,200 milligrams. When pregnant, it is important that you are reaching your RDA goal for your age group. You do not have to exceed that limit, but it's very important that you are meeting it. as it's vital to the infant. Calcium deficiency and inadequate intake affects your bones and muscles, including your heart. Calcium deficiency may lead to osteoporosis, a disease where calcium is removed more than it is deposited, resulting in bones becoming porous and fragile. Someone with osteoporosis, their bones are very easily fractured. Osteopenia is yet less severe. It's a disease in which the uptake is higher than the deposit of calcium in bones, but not to the degree of osteoporosis. Calcium toxicity. Calcium toxicity can lead to hypoglycemia. Symptoms include, but are not limited to, numbness, tingling in fingers. Calcium toxicity can lead to hypoglycemia. Symptoms include, but are not limited to, numbness, tingles in fingers, muscle cramps, convulsions, lethargy, abnormal heart rhythm. If untreated, too much calcium in your system may result in kidney stones, as kidney stones are commonly composed of calcium oxalate. Supplements versus food sources. There are two forms of calcium supplements: calcium carbonate and calcium citrate. Calcium carbonate is common, inexpensive, and convenient. It should be taken with food as it relies on stomach acid for digestion, and it's 40% the weight of calcium. Calcium citrate is the other form of calcium supplement. It can be used to treat alcoholia, inflammatory bowel disease, and absorption disorders. It can be found in some fortified fruit juices, and it's 21% calcium. Food sources that you get calcium from are dairy products, soy products, fruit juices, leafy greens, tofu, and cereal. Dairy products as in milk, cheese, yogurt, butter, etc. Leafy greens are very minimal in calcium, but they can be found in cabbages, spinach, broccoli. Calcium deficiency and inadequate intake affects your bones and muscles, including your heart. Calcium deficiency may lead to osteoporosis, a disease where calcium is removed more than it is deposited, resulting in bones becoming porous and fragile. Someone with osteoporosis, their bones are very easily fractured. Osteopenia is similar to osteoporosis, but not as bad. Osteopenia is similar to osteoporosis, yet less severe. It's a disease in which the uptake is higher than the deposit of calcium in bones, but not to the degree of osteoporosis. Other facts. Calcium is the most abundant mineral in the body. Calcium is actually an electrolyte. Calcium supplements can cause gastrointestinal issues, such as constipation, gas, and being bloated.